Hello, everyone. How is your heart doing today? I am so delighted to welcome you to the Heart to Heart live conversation with Dr. Ganeshakrishnan Iyer, which is part of the Healthier Hearts initiative launched by Dr. Iyer. My name is Shahid, and I am privileged to be asking the questions on behalf of the audience who have posted these questions on the Healthier Heart social media channels and other properties. If you still want to ask any question, please drop it in the Q&A section, and I will ask Dr. Iyer based on the availability of time. If you get stuck, please refresh your screen, and you can find the Q&A tab on the top of your screen, and you can leave your questions there. Dr. Ganeshakrishnan Iyer, a stalwart in the field of cardiothoracic and vascular surgery, and with over 25 years of experience in the field, has more than 12,000 open heart surgeries in the last 2.5 decades. He has been constantly involved in complex adult and pediatric cardiac surgeries. His areas of special interest are mitral valve repair, minimally invasive cardiac surgery, aortic aneurysm, aortic valve sparing procedure, and surgery for atrial fibrillation. Dr. Iyer worked with leading multi-speciality hospitals as a chief cardiovascular surgeon prior to joining Aster CMI as lead consultant in the Department of Cardiothoracic and Vascular Surgery. He has extensive experience in teaching field and has been training graduate medical students on basic clinical surgery and patient management for both routine and emergency cases. Dr. Iyer loves music and adventure sports. He's been an avid trekker, cyclist, and loves to travel when he can find time. Dr. Iyer, welcome to your own show.
Welcome.
So, Dr. Iyer, the first question which comes to my mind, and I'm sure a lot of people want to know, what is Healthier Hearts, and what is the goal of this initiative?
I think to say it shortly, it was mostly that there is a lot of information available to people today, either via the internet, the social media platforms, and a lot of other resources. But I find that many of them were not authentic, or they were not very accurate, or they were not serving any specific purpose. So I thought just to distribute credible information about heart, its problems, and heart diseases, relevant therapies, what are the options available. Thought we just put it out in the public domain for people to access. That was the whole goal behind this initiative.
Okay, that's very noble. Is this charged? Is this free, or are you charging for it, or anything like that?
No, it's entirely free. It's
Okay.
for anybody to access it. It's available free on the net. There are no charges and things like that. Absolutely free for them.
Okay, and is this only for heart patients, or other people can benefit too?
At this point, anybody who seeks pertinent information regarding heart diseases can go to the website and check out the information that's there. It is still a work in progress. Not everything is covered there yet because creating content takes time and effort. So we are in the process of working. Shahid is helping me out with it, and yeah, it's. I would still say it's work in progress. I would say it's probably maybe we have done 5% of the work or even less, but there's a long way to go. But
Okay.
we'll stick to it. We'll
Okay.
persist and see what information we can put out there.
So before I take on questions from the audience, one question which is probably I want to know, and probably some other people also want to know, what is cardiothoracic and vascular specialist? Can you explain what exactly is CTVS or cardiothoracic and vascular surgery?
Yeah, this is a very important question because many people think me as a cardiologist just because I specialize in the heart. Uh, So basically, if you were to divide all medical specialties into two groups, one is the medical part of it, that is the physicians, say equivalent of a cardiac specialist would be a cardiologist. So these people examine the patient, do the tests, and come up to a diagnosis. Most of the times, it so happens that these diseases can be treated or managed with medicines, and the problem ends there for the patient. But however, some medical conditions require a surgical solution. You have to operate on the patient. And my specialty involves operating on the heart, the lungs, basically anything between your collarbone and above your abdomen. So anything that comes in that area. So heart and lungs are the main two organs in this vicinity, other than mediastinum and esophagus and a few other organs or structures. And vascular surgery. Vascular surgery is surgery on the blood vessels. So there are many conditions which require a surgical solution, which cannot be managed with medicines or tablets or some blood thinning agents. So cardiothoracic and vascular surgeon essentially does surgery on the heart, the lungs, and the blood vessels in the body.
Wow, that seems like a lot of work and lot of organs of the body, doctor.
Not
So,
really, not really, only two or three.
okay. Well, sounds complicated, but anyway, I'll move on to one of the questions from our audience, which is asked on our social media channel, and it's by Asha J Nadar. She says, due to anxiety, I'm getting slight chillness, pain in left chest, and sweating. Is that anything to do with heart? I get anxiety when I drive long hours in car, etc. And is fatty liver anything to do with heart, and how to get 100% cure from fatty liver?
Well, I think I saw this question as well, and I know Asha very well. She's a young lady. I don't think she needs to worry about the heart problem. Basically, anxiety can present in many other ways, like sweating and palpitations, chest pain, and a few other such symptoms. Because anxiety is more a psychological issue than it's really a cardiac issue. So I don't think if she's really worried about the cardiac issue, the best thing is to do a treadmill test and sort it out. As regards fatty liver is concerned, I think almost more than 50% of Indian population has a fatty liver. It depends on the grade to grade 1, grade 2, grade 3, and so on. So as long as it's a grade 1 or a grade 2 fatty liver, I don't think you need to worry about it or take too much stress about it. But it's nice to keep it under a check and keep a watch on it, because there is an entity called as non-cirrhotic or non-alcoholic cirrhosis of the liver, to which this fatty liver is a precursor. It happens before you get cirrhosis of the liver. So just keep a watch on it. You don't need to do anything specific to get rid of it, because most of us have it. Even I have it. So, but keep a watch on it. Check your liver enzymes at least once a year and make sure it's not getting any worse. That's all I would say.
There you go, Asha. No need to worry too much. Keep a check on it. Next, I'm going to combine two questions, doctor. One is from Dinesh Babu, and he's asking, "Hi, sir. How are you? Please tell a tablet that can cure heart disease." I wish there was one tablet for everything. Second question is from Subramaniam Ramadurai. He says, "Dear Dr. Ganeshakrishnan, I have registered for the webinar, but I'm not sure whether I have time. Oh, the time will be suitable as there is a time difference between India and California. And I want to know your views on the heart supplement, COQ10, how effective it is in supporting the heart. It is also stated that it is good for statin users. Kindly give your views, please."
Okay, regarding the magic pill for curing heart disease, one does not exist, as you rightly mentioned. So that throws it out of the window, because one needs to see what the problem is, and if there is no problem, there is no need to take any medications. But if there is a problem, we have to identify the cause of the problem and try to treat the cause. If the cause is not treatable, then we should address the symptoms either which way, but obviously there is no magic pill. Coming to Ramdurai's question of coenzyme Q10A, it's an enzyme actually. Coenzyme Q10, CoQ10, that is coenzyme Q10 is, I don't know if he understands biochemistry, but it is a part of the mitochondrial electron transport chain. That is when we eat food. In the body, this food is processed to convert it into energy. You require energy for talking, sleeping, walking, doing whatever you do. So how this energy is actually released is it's in the form of a molecule called as adenosine triphosphate, which is a high energy molecule. And in the mitochondria, it's a component organelle of the cell where this undergoes an electron transport sequence where progressively electrons are transferred from various components of this electron transport chain, where electrons are released and therefore energy is released, which gives the power or the energy to do whatever you want to do. And coenzyme Q10 is a part of this electron transport chain. Now, incidentally, how our body manufactures this coenzyme Q10 is pretty much almost the same pathway to 80% as the same way that the body makes cholesterol. So if you're going to block the formation of cholesterol, you're also going to block the synthesis of coenzyme Q10. And there is a theory that coenzyme Q10 levels are low. Now, coming to Ramdura's question of my view on this, that it is not scientifically proven that taking coenzyme Q10 supplements is beneficial in any way while you're taking statins. There is no scientific evidence to this. But on the other hand, if you feel like you want to take it, by all means go ahead, because I don't think there's any harm in taking it. But the coenzyme Q10 deficiencies are not documented in patients who are on statins, even high-dose statins up to 80 milligrams of atorvastatin. Coenzyme Q10 deficiencies or these kind of side effects of coenzyme Q10 deficiencies are not documented. But because it doesn't cause any harm, as well, if you feel like, go ahead and take it. But I don't prescribe it to my patients simply because there is no scientific evidence to that.
Okay.
A long answer, but yeah, I think the question needed that. So.
Sure, absolutely. I'm going to move on to Sandhya Prashant's question and another question from anonymous visitor. So Sandhya Prashant's question is, what's the secret for a healthy heart? One tip for women. And another question is, if I'm a woman, are the symptoms same?
So I'll answer the second question first. Pretty much the symptoms are the same. Say if you're having an ischemic heart disease, you may have chest pain on exertion, palpitations, breathlessness. Pretty much the symptoms are the same. And the first part of the question was, if I'm a woman, how can I protect my heart? I think whether you're a woman or a man, the things you do are generally the same, because the heart is not gender specific. However, I would like to emphasize that in terms of coronary artery disease or the disease that causes the heart attacks, women are naturally protected during their years when they're ovulating. Let's say from menarche to menopause, they are naturally protected because of their hormone systems. So very few women have heart blocks or diseases in this age group. But once they achieve their menopause or their periods stop, then the incidence is pretty much the same as men. So, and obviously, again, there is no one magic tablet or a pill. The way to protect yourself from heart disease is pretty much standard. I mean, it's there available on our website, but for the sake of the audience, I'll repeat it. Is that you should have a healthy lifestyle, avoid excessive, high cholesterol containing foods, exercise regularly, control your cholesterol if it's high. If you're a diabetic, control your sugar. If you're a hypertension, take medicines to control your blood pressure. Avoid other risk factors like excessive alcohol or smoking. And if you have a family history that is a family prone to ischemic heart disease, then I would suggest that you have an annual checkup regularly. Cut down your stress. If you can meditate, do some meditation, yoga, and things like that, so that cut down your stress levels. This is the best you can do. In spite of all this, if you have bad genes, unfortunately, you will end up with the disease, but you may prolong it. Instead of getting it at the age of 50 or 60, you may push it to 70 or 80. So that's the way it is. The general instructions are pretty much the same. I don't think I would like to separate the sexes and give different advice to them on this issue.
Okay. Now I will pick up some questions from our live audience, and there are some questions in the chat section as well as in the Q&A section. First, I'm going to start with a question from Nazneen Tonze. I hope I have pronounced it right, Nazneen. Hi, doctor. My mother, your ex-patient for 4 years, patient 4 years back, Mrs. Jugnu Tonse wants to know what are the things she should avoid to maintain her health. How active can she be, and is there a limit to the amount of fluids she can take?
That's Nazu. Yes. Okay. Well, as far as Mrs. Tonse is concerned, I think she can do whatever she wants. She's an elderly lady, and we should not put too much restraints on her. Obviously, she's not going to go climbing Mount Everest anyway. But there should be no restrictions on her physical activity. And things she should maintain to maintain her health, I just said. I mean, these are standard things. There's nothing specific as far as Mrs. Tonse is concerned. The amount of fluid she can consume depends on what her current heart function is, which I assume is normal. If her heart ejection fraction is more than 40 or 50%, there should be no restrictions on the amount of fluid that she can have. But that doesn't mean she can drink 10 or 12 liters of fluids per day. Obviously, nobody's going to do that. But there is this other school of hydrotherapy where people drink some 8 liters of water through the day and try to flush the toxins out of the body. That sort of a thing could be harmful, but most of us have between 1 and 2 liters of fluids per day, including water, tea, coffee, or whatever it is. So I think that should be okay. It should not be too much of a problem for her.
Okay. Next question in the Q&A tab is from Koel Ghosh. She is reaching out to you from Kolkata, and she's asking, these days, because of wearing a mask, a lot of people feel suffocated sometimes. The heartbeat gets slow. Is it the sign of heart problem?
Certainly not. It's not a sign of a heart problem. If you're going to wear a mask, especially the thicker varieties of the N95 or those respirator types that, So what happens is our oxygen intake becomes slightly less, and there's some degree of carbon dioxide retention in the body, which can cause the heart rate to go up slightly. But I don't think one should worry about it. Continue to wear the mask as long as you're outside, especially during the pandemic, until it gets over. Certainly, Koel, it's not an issue of underlying heart problem. But if the heart rate is going to 120, 130, then yes, you should consult your cardiologist. But if it goes from a baseline of 70 to 80 or 90, I would not worry about it.
Okay. In the Q&A section, Doc, we have a question from Shrikant Subramaniam. If I know him right, he's reaching out from TCS, and he's asking, how do you address metabolic syndrome with high triglycerides and low HDL? I'm not very good at pronouncing some of these words, but doctor, you got it right.
Yeah. Don't worry, over time you will get good at it. But coming back to it, see, metabolic syndrome is a very complex disease. It is, as he rightly pointed out, most of them are obese. Some of them are type 2 diabetic. Some of them have high triglycerides, uh, low HDL levels. We have to tackle them as individual components. I'm not aware of any one tablet that can deal with all these things. And the general advice is still the same: exercise regularly, regulate your diet, check your cholesterol, keep your cholesterol under control. Now, as far as triglycerides is concerned, it's a bit more complex. There is a tablet that's available. We can reduce the triglycerides significantly. It's called fenofibrate. I would not advise you to take it without consulting your doctor. However, uh, the role of triglycerides, or the exact role of triglycerides in the causing of ischemic heart disease, is not yet clear to medical science. We know cholesterol is directly related. We have got, familial hypercholesterolemia and syndromes associated with that, where ischemic heart disease is a common entity. However, the exact role of triglycerides is unknown. That's number one. Um, as far as getting HDL level up is concerned, there are no tablets that can do it. You have tablets to decrease your LDL cholesterol, but the HDL cholesterol, to increase it, yes, the same tablets do increase the HDL cholesterol by a fraction of 10 or 12% from what the baseline is. The best way to do that is regular exercise, where HDL cholesterol increases by another 8 to 10, 12%. And I don't know if I should be saying this in a public forum, but if you do consume alcohol, a glass of red wine or a couple of glasses red wine also is known to increase your HDL cholesterol and is protective because of the flavonoids that the red wine has. It is not same true with other alcohols, other spirits, and with white wine as well. So if you are having it, so if your HDL is low, start running every day or do some heavy exercise. And if you already consume alcohol, you can try a glass of red wine for every night, and then check it out at the end of a month or so as to how your HDL is doing. But other than that, there's nothing you can do to increase the HDL, because it's basically controlled by your genes.
Interesting. So, doctor, since you talked about wine, I have a question. Can a glass of red wine a day help keep the heart doctor away?
Maybe not forever. Yeah, but there are some there is some literature and documents that's available to suggest that people in whom the HDL levels are very low, a glass of red wine is protective against coronary artery disease. Yes.
Okay. Now, in the Q&A section, again, we have Nazneen asked another question. Are palpitations harmless?
Not really so. You have to know what the cause of palpitations are. Palpitations can be caused by anxiety, excitement, etc. They are, or fear for that matter. They are harmless palpitations. It's a natural body mechanism of protective mechanisms in the heart. But if you're having palpitations in absence of anxiety or stress or excitement or any such thing, say you're having palpitations in your sleep and you're waking up, or you're having palpitations just when you're reading a newspaper, you should get it checked out. I would not think it's totally harmless. We should do a Holter or an ECG to check as to what is the nature of palpitations, where are they coming from, and many times they are curable. So I think you should get it checked out.
So, Doc Shrikant just commented, thanks, doctor, but I am a teetotaler. Will continue my exercises. This actually went up in the lockdown period.
Yeah, so continuous exercises, I think that will help him quite a bit, because HDL, and it's very, let me be very honest, it's very, very difficult to bring up HDL to what the recommended levels are. Just to divulge some facts, my HDL level last time, I mean, when I checked it a few years back, was 23. I exercise regularly for an hour, put in lots of hours in the gym, etc., etc., etc. And at the most, I have been able to push it up to 34 from 23. That's about 30% increase. That is huge, actually, by HDL terms. Uh, but the recommended say less than 40 is abnormal. I have never been able to touch it to 40 so far in my life, but I'm still trying.
Okay. That's a very interesting example. Shrikant, I hope you're noting that. Okay, doctor, there's a question on health. And Ashwin Jairam, who asked this question on our social media channel, is saying, or rather asking, is drinking coconut oil regularly good for health?
The answer to that is I don't know. Not that I don't know, but it's not scientifically proven to be of any significant benefit in science. Yes, I have also seen a lot of videos here and there on YouTube and other places that suggest that drinking coconut oil is beneficial. Uh, but as I said, in absence of scientific evidence in that matter, it would be inappropriate for me to comment on that.
Okay. Okay. Fair enough. Okay. We have one more question from Sandhya Prashant. She is asking, does sleep or lack of it have an impact on heart health? Do we really need 7 hours? I surely don't get as much.
Uh, well, I would not say heart in particular, but I think 7 hours to 8 hours of sleep is definitely good for the overall machinery of the body to regenerate, give it some rest, and be able to function for the next 12, 18 hours. If you're not getting that much, I would urge you to find a way to get that much. And if you're not able to sleep because of various reasons, either anxiety or stress, you should get that looked into and worked upon. But I personally feel everybody should get at least 6.5, 7 hours of sleep to be functioning optimally the next day. I mean, and this is just a overall well-being kind of an answer rather than, I don't think it affects the heart particularly, because whether you're sleeping or awake, the heart is beating anyway. So I don't think, but if you're not sleeping because of stress, there could be additional burden on the heart, because stress definitely affects the heart. But if you're not having stress but just not sleeping because of doing other things, I would reconsider my lifestyle choices.
Okay. Okay. Going back to chat section, Doc, we have a question from Ravi Patravali. He's asking, is stent pacemaker insertion a part of heart surgery discipline?
No, those are done by the cardiology, the medical specialty of it. But if stent is not possible, then the surgeon comes into play. But placing a stent in the coronary artery is essentially a cardiological procedure. We call it interventional cardiology. So cardiology, you put a stethoscope, do an ECG, do an echo, go to the next level where you intervene in a physical, in an invasive way. So that's the domain of the interventional cardiologists. Not all cardiologists are interventional, but many of them are.
Okay, and Koel says, thank you, Doc. And then Ravi is asking, role to walking in reduction of triglycerides. What I mean, you were talking about it, right? And there is a similar, I'll probably come to the other question. Yes, Doc, on the role of walking.
Yeah, as I said, the role of triglycerides in heart disease is itself very poorly understood. So, like if you have got very bad control of your diabetes, your triglycerides will tend to be high. If you drink a lot of alcohol, your triglycerides are high. The role of triglycerides in heart disease is not well documented yet, or is poorly understood. I am not able to answer the question specifically as to whether walking will decrease triglycerides. I don't know the answer to that question. Though it does affect HDL cholesterol levels to go up and brings down the LDL cholesterol, the effect on triglycerides of exercise is again poorly understood.
Okay, and there's a comment from Nazneen. Thank you. I will get my palpitations checked out. I am premenopausal and get them frequently, often after an afternoon nap. Sometimes notice that my heart starts pounding as soon as I lie down. I'm 55.
Yeah, ask her to see a cardiologist. Can get an ECG and evaluation done, or maybe a Holter to see if it's abnormal. I doubt it is, because in perimenopausal there are a lot of hormonal changes that take place in a woman's body that could explain it. But I would rather get it checked out rather than just ignore it.
Okay. So we have about 13 minutes to go. Ladies and gentlemen, if you have any more questions, please feel free to drop in the chat or the Q&A section. We have one more question from Koel Ghosh Doc. She's asking, as per the information collected from my circle, I understand people who are working from home are having more stress and heart problem than earlier times when they used to work from office. What can be the ways to avoid situations like this?
Uh, I'm assuming she's asking how to avoid how to avoid stress, because I don't know how to avoid the pandemic. Because the situation is, we are all sitting at, or most of them are sitting at home and working because of the pandemic situation, and stuff like that. I think the only way out of this is to have some relaxation techniques. Use yoga, meditation, or whatever suits your, whatever relaxes you. If relaxing, watching a movie relaxes you a little bit, please go ahead and do that. If you play carom or something with your people at home, you can do that. But I think you cannot work 24. Now, what has happened with this work from home is that you're always at work, in the sense that there is no work time and there's no home time. I think if you separate that, have work time even at home and have home time at home, most of the problems would be, stress would come down. But if you're still feeling stress, I would recommend trying yoga or meditation. In my experience, it definitely helps in cutting down stress.
Okay. Doctor, another question in the chat section from Ruchi Dattani. She's asking, hi doc, my daughter's pulse rate goes up to 130 when we try checking the oximeter. Should I be bothered?
Yes, if it's always 130 or more, you should be bothered. But if it's occasionally, like 1 out of 10 times more than 130, maybe she's just excited or happy or sad or angry or whatever, emotional at that point. But if it's always 130 and more, there is an issue. And I don't know what the age is, but if it's a very young person, then I would not worry about it. But in anybody over 12 or 13 years age, 130 is a very high heart rate and should be looked into.
Okay. So I'll take a few more questions and then we will wrap it up for this session at least. I have a question, Doc, which is related to, okay, so my parents had heart disease. Am I doomed? Is the question.
No, you're not doomed, but it all depends on what type of heart disease. Now, ischemic heart disease is certainly genetically, genetics is a risk factor. But if it's a valvular heart disease, it's unlikely to be genetically transmitted or be responsible for it. So, assuming that the question pertains to ischemic heart disease where people have heart attacks, you're definitely not doomed. I think you can make sensible lifestyle choices, get yourself checked regularly, detect the problem early and get it treated. I mean, treatments are available. It doesn't mean that you have a heart problem means you're dead. There are millions of people living with heart problems and after heart surgery for decades. So I don't think you are doomed. Definitely not.
Okay. This is an interesting question, Doc. Do surgeons need to break ribs to perform open heart surgery? Even I want to know that.
We don't need to break them. There are two ways of getting inside the chest. Obviously, heart and lungs are encased in our rib cavity. But what we normally do is we go through the front of the chest, which is a bone called the sternum. So we don't touch the ribs, but we do cut open the sternum and then go inside. But for lung surgeries, we also don't cut the ribs. We go in between the two ribs and then spread them apart with a retractor and then go inside and do what we have to do. So if you're going from we are not breaking any ribs, but we cut open the breastbone. If you Google breastbone or look it up on the net, you'll know that all the ribs come here and attach to one bone in the front of the chest. It's along what we in medical language call as the sternum. So you cut the sternum and go inside, and then put it back together, and it heals just like a fracture. No big deal.
Okay. Now, one more question related to exercise. Can exercise really make my heart stronger?
Yeah, it's like if you pump iron in the gym, your muscles are going to get stronger, right? Similarly, exercise will make your heart stronger, definitely. It's like exercise is like uh, what do you call pumping iron for the heart.
So, doc, is it like the more blood flow because of exercise which is helping, or there is much more than that? Oxygen, blood flow, or more blood? What is happening?
It's a complex thing, but overall, I would say that if you work any muscle more, it's going to become stronger
Okay.
naturally. If you use your right hand more than the right hand is going to be stronger than the left. It's common sense. So similarly, if you exercise your heart, that means you're increasing the heart rate during exercise. So it's working more. So it is naturally going to get adapted to working more and be stronger.
And that thing called cry heart, right? That you should not. If so, maybe. But if you do it to overdo it, that is also not right. If you overdo or if you over exercise, could that
I,
be detrimental?
I don't think you can over exercise the heart because it will not let you. You will get tired and you will naturally stop. You will not be able to exercise. Like you cannot injure your heart by exercise, like how you can injure a biceps or a quadriceps by doing gym.
Okay.
There's no way you can injure your heart by exercise. That cannot happen.
Okay.
If your heart is already weak or damaged due to some reason, and then you try to push it, yes, in that situation you may. But a normal heart you cannot.
Okay. Okay, I'll take these last two questions from Nazneen and then one more from our audience, and then we will wrap it up. So Nazneen's question is from her mother, I think, Jugnu Tonze. Are there any taboo foods for me as a person with a valve replacement? I have full faith in you. And the next one is any foods that help to have a stronger valve?
No, because I know Mrs. Thornse very well, and she has a tissue well. So because she has a tissue well, there are no taboo foods, and by corollary to that statement, there are no foods that can improve your heart valve, because heart valve disease is a purely degenerative disease. It's not caused by food or exercise or any such thing. It's not caused by environmental factors, especially the type of valve disease she had. So to answer to both the questions is no.
Okay. So I hope I have covered all the questions from the chat and Q&A section. Okay, so last question. I will probably end this by asking, what are the warning signs of heart disease? If somebody has to be careful and if they have to keep an eye on some of the symptoms, is there anything you would like to guide us? We should be careful about.
No, I think my own philosophy is if something is wrong with the body, it will let you know. Either you will have breathlessness, chest pain, some kind of discomfort, palpitations. And if you have any of these symptoms, you should just go and get it checked out and make sure that there's nothing seriously wrong. And I think my advice would be for people uh, in whose family there is a history of heart disease. I think those people have to be a bit more careful than the other people, because I personally feel that genetics plays a very significant role in the coronary artery disease, in the development of coronary artery disease, and therefore they are the people who should be extra careful about lifestyle modifications.
Okay, that's a good point. So, Doc, with that, really want to wrap this up. I want to thank everybody who has joined this session. This is the first ever session on behalf of the Healthier Hearts Initiative driven by Dr. Iyer, and many more to come. And I hope people have subscribed to the YouTube channel, because that's where you're going to find the recording of this video. And if you want to know our YouTube channel, you just have to type GKT Iyer on YouTube and you'll find the channel. And of course, you can visit gktiyer.com website, where you will find much more detail and a lot of videos and other information. So, Dr. Iyer, thank you for taking out time and answering all the questions from the audience. On behalf of your patients and audience, I would like to wish you the very best and success to Healthier Hearts Initiative. It's an amazing initiative. Thanks for educating and guiding us.
Thank you so much. Thank you, everybody.